All right, we'll be starting the meeting shortly. We're starting with an opening prayer, followed by the national anthem. The first person to introduce here in the chat box will be taking the opening prayer for us. That's Mr. Lawal Abdurrahman. Mr. Abdurrahman, if you can hear me, can you please take the opening prayer for us as we commence the summit? All right. It appears Mr. Rahman is now available. So I'll take the opening prayer from here. Let's pray. Heavenly Father, we thank you for today. We thank you for this summit. Thank you for this gathering together to discuss on the topic leadership in public health. Lord, I pray as we gather to deliberate, you grant us insights on this topic in Jesus' name. And you help us to lead a better nation in Jesus' name. In Jesus' name I will pray. Amen. So up next, we'll be having the national anthem. To take the national anthem, we have to we'll all keep our mics muted while one participant leads the national anthem. So Blessing obeys. I can see your name here. Can you please lead the national anthem for us while our mics are muted? Sorry, I think Blessing is not available. If you'd like to lead the national anthem, you can just signify by a raise of hand. Anybody?
It's rubbish.
Okay, Ms. Pelumi Shubayo will take the national anthem for us. So let's all keep our mics muted as Ms. Pelumi takes the national anthem.
Arise, O compatriots, Nigeria's call obey, to serve our fatherland with love and strength of faith.
The labor of our here prospers. Make I off my mind.
All right, thank you very much. I believe she had a network issue. So we'll be our next order of events. We'll have a goodwill message by the Dean of Clinical Sciences of Bafemi Awolowo University, Professor Showande. You're welcome, sir. You can unmute your mic, sir.
Can you hear me?
Yes.
Yes, we can hear you, sir.
All right.
Yes, sir.
We can hear you, sir.
Let me thank you for inviting me to join this your leadership summit.
See me now, see my room here. You need 24, ma? Just 22, this is not 23. Okay.
A lot of background noises.
I don't hear things to happen here.
Hello? Hello? Hello?
Yes, sir, we can hear you.
Yes, sir, we can hear you, sir.
Okay. Yeah, I want to first of all
I think you're muted. Yes, I think so.
can you hear me now?
Yes, sir.
All right.
Yes, sir.
Yeah, I want to recognize, first of all, the distinguished speakers that you have invited for these programs. I've seen, they are really distinguished in their, in their position. And I want to say, I thank them for coming to address you on public health issues. I also want to thank you, the NiMSA leadership, for inviting me to join you for this summit, especially the Standing Committee on Public Health, which I assume our own dear Temitayo Matthew is playing a very important role. There's no doubt that you guys have done well by choosing to address issues in public health. And the theme that you have chosen, repositioning the public health sector in Nigeria, is an important theme. We all know that public health issues ranging from communicable to non-communicable diseases is very rampant in our community. And public health is actually the pillar on which we can deliver, universal health coverage by addressing all public health issues. And the modality for addressing this, I'm sure, will be addressed by our great speakers. I am very happy to say that here in Ife, we also take it, to a high level, the issues of public health. And we continue to produce graduates who are globally relevant in issue of public health.
Hello, sir. We can't hear you anymore, sir.
Surely. And we will have been prepared for a greater role in the future when it comes to the field of public health. And I can see there are over 100 participants here. I can see all of you going places. And wherever you get to, now and in the future, don't ever forget public health. So once again, I want to thank you for inviting me, and I wish you fruitful deliberation as you go along in your summit. Thank you very much.
Thank you very much, sir. Very glad to hear from you once again, sir. So up next, we'll be having the welcome address by President Webster Honora, the NiMSA president. President Webster, you can unmute yourself now. And
okay. Good evening, everyone. Good evening to our distinguished speakers, our distinguished guests here present.
Good evening, sir.
On behalf of, can you hear me?
Yes, we can hear you, sir.
Okay. Webster Honora, the National President, Nigerian Medical Students Association. And on behalf of the NiMSA leadership, we welcome you to this Public Health Leadership Summit, a one-of-a-kind summit. And I must thank the NiMSA SCOPH national team for coming up with such an event like this. I think we, the future healthcare professionals, we are architects of a sustainable future, and we all need to work together and to ensure that which we aim to achieve, that for a better healthcare setting of which we are advocating for, and public health care settings in our country of which we are advocating for a greater change, that we will need to work together to pursue that sustainable path. And in the light of that, you cannot give what you don't have. And we believe that through this Public Health Leadership Summit, we'll be able to acquire the necessary skills and the necessary knowledge to pursue that sustainable path towards public health. We live in very volatile times, but I'm confident that whatever challenges we'll meet at the public health care settings, that through this summit, we'll be able to equip ourselves with the necessary knowledge, the necessary insights to tackle them. And once again, I say welcome to the NiMSA Public Health Leadership Summit. And I believe we all came here expectant, and I believe the NiMSA SCOPH national team and our distinguished guests and speakers would never disappoint. So stay put and let's learn from our distinguished speakers. Thank you so much.
Thank you so much, President Webster. It was nice hearing from the NiMSA 45th. So up next, we'll be having our first session for the day. I invite the director of NiMSA SCOPH to invite the next speaker.
All right, good afternoon, everybody. Thank you very much. Standing existing protocols, we want to render our sincere appreciation to Dean, Professor Dayo Shuwandi, who has joined us this afternoon. We are very grateful to have you, sir. I also want to appreciate the NiMSA leadership headed by the President, the 45th President, President Webster Unora. Thank you very much for being here as well this afternoon. Very quickly, I was supposed to deliver an address as well, but I think because we have spent some more time, we are way behind on our schedule. We'll make things very fast and we'll just exit the stage now for us to listen to our seasoned and very intelligent guest speakers. I also want to bring the notice of our speakers that this meeting is being streamed live on Facebook. We have a significant number of people joining us live from Facebook cannot make it to the Zoom call. We in NiMSA this year, we are a team. We are raising an army of passionate public health student physicians. And we are hopeful that this humble efforts of ours will lead to very mighty initiatives that will shake the Nigerian healthcare sector in the coming days. Thank you very much for joining us. Thank you all for being here this afternoon. In a moment now, we'll be listening to our speakers, and I must also recognize them again for joining in this early. Thank you very much, everyone. We hope that we have a nice time learning. Thank you very much.
Thank you very much. The SCOPH director, Mr. Ifedayo Matthew. So our next speaker is Dr. Jimlas. Before he comes up, I invite Ayumbele Rochelle to read the citation.
Okay, I'll read the citation of Dr. Jimlas Ogunsakin. Dr. Jimlas Ogunsakin is a medical doctor, a health system specialist, an entrepreneur, a leadership coach with a contagious passion for nation building. He is a fellow of the Royal Society for Public Health, England, a member of the American College of Healthcare Executives, and many professional institutions. As an international development expert, he has considerable experience working in multi-agency environments in Nigeria and the UK with leading NGOs, UNOs, with parallel network across the private sector and development agencies. As a serial entrepreneur, he sits on boards and trustees of some profit and non-profit organizations. He is the CEO at South Atlantic Health Systems Limited and president of the Global Network of Emerging Leaders in Nation Building, GLEAN Africa. He is a chieftain of the ruling APC from Ekiti. For the passion to serve the nation, he had contested for the North House of Reps elections in 2016 and 2019 under the APC. He is presently the senior special assistant to the governor of Ekiti State. Dr. Ogunsakin is married to Helen Atinuke and blessed with Kayla Omobodola. Help me welcome Dr.
Okay, am I allowed to speak now?
Sir?
Am I allowed to speak now?
Yes, sir, you have the floor, sir.
Okay. Can you all hear me? Good afternoon, everyone. I'm glad to be here. Thank you for inviting me. And I'm really proud of what NiMSA is doing. You guys are great. You guys are really great. Thank you so much for contributing to the discussion of healthcare leadership in Nigeria. There's quite a lot of things to talk about. Because of the time that I have this afternoon, I'm just going to up to your conscience, to your emotion of guilt, if I put it that way, and your emotion of love, and of course, your emotion of power to belong. Very advent of COVID healthcare for healthcare leaders to rise up, challenge, and assess. We've through quite a lot of stages, especially our health system, and we have also done a few stuff. We made some progress over the years, and we're also trying to make some progress at the moment. So I'll be speaking on leadership as a sense of dignity and self-respect. I'll be talking about leading the public sector with a sense of dignity and self-respect. As I say, when I have the opportunity to speak to young people, I say that leadership is very critical to how far you will go in life. There are different levels of leadership by different postulations and different authors and stuff like that. But the one I particularly like is the one, the systematic that talks about leading self, and from leading self to leading others, and from leading others to leading teams, from leading teams to leading organizations, from leading organizations to leading the nation, and of course, from leading the nation to providing a generational leadership, a transgenerational leadership. It's very significant for individual to build their self-leadership capacity so that you can be more relevant in the scheme of things, so that you can be able to contribute your quota to development of the sector that you belong to. There are quite a lot of issues that needs your leadership ability, and that needs you to, that is pointing to you at the medical student level to say, you know what, you need to build your leadership ability so that you can have the capacity to respond to some of the challenges, whether now or in the future. Because of the nature of our medical education in Nigeria, I know that at our level, it seems as if we're not even able to do much, but sincerely speaking, trust me, this one that you have done this afternoon is a very big one. And of course, it will speak to quite a lot of people, speak to their conscience, for them to begin that process of re-engineering, that process of mind re-engineering. There are quite a lot of issues in the Nigerian system. A lot of issues, and of course we all know issues, but I'll just try a few ones and think of what the way forward should be. If you look at the structure of the Nigerian health some today, the structure of the Nigeria healthcare system, that structure was set up quite some time ago by some very brilliant guys, based on narrative at that particular time. It will also interest you to know that it is one thing to have a structure, and it's also a thing that for the structure that we have, to have the capacity to carry the issues or the problems that we have on ground. So when we talk about structure of the Nigerian healthcare system or health sector, we're talking about the organizational structure. I know you know what that means. We're talking about the institutional structure, the public health system, the public health institutions, how they are structured, and we're also talking about the governance structure, how the health sector or health system is being governed from the policy level, the implementation level. There have been a lot of attempt for the healthcare structural engineers to build what they call an integrated service delivery network, so that many of the issues that we are having with fragmentation of care and the fragmentation of healthcare can be addressed. So I'm saying that. So, for instance, let's look at the primary healthcare system. For example, the primary healthcare system. I'm sure you all know the PHC, which is supposed to be the first point of care at the community level. the primary healthcare system is the closest to the population, and it is supposed to be able to cater for a high level, for population like it caters for. I mean, across the range, of the health of the service delivery systems. So for instance, PHC can cater to some things. Of course, you can have delivery, you can have a treatment of diarrhea diseases, and some of those other things, and of course, malaria and a lot of communicable diseases, if I may put it that way. But it's also important for us to look at the structure of the primary healthcare system and what the primary healthcare can do. Questions that should go through the mind of an average medical student is that I'm trained in a teaching hospital. Why do we have to cater to malaria at the teaching hospital level when malaria is supposed to be catered for at the primary health care level? And I'm not talking about complicated malaria now, severe malaria and all of that. Even at that level, it should be catered for. Why is it that, the entire structure of the system level, is not... mortality, for instance, and you begin to wonder, with all the investment that goes to our primary health care, why are we still having this huge number of maternal mortality, in the country? And of course, you flip to the other side, then you see these other sets of traditional birth attendants, and from whether faith-based organizations or community-based organizations that have been practicing that career, let me put it that way. And it's been handed over from generation to generation. In Yoruba, we call them yeah, baby. So people take deliveries at that level. Have you come to think about it, that what can we do? Is it possible for us to begin to think of how to integrate that level of care, even though it is traditional, it is not orthodox in the sense of it, but because over 70% of children that are born in the rural areas are born in those traditional homes. And this kept increasing our numbers, our maternal. So when things goes bad, at that level, that is when they now begin to come to the hospital, if they do at all. So a lot of interventions has been done by partners to even try to educate people at that level of care, to understand emergency obstetric care, and all of that, and see how they can make referral to the next facility, primary health care facility, and even so they can even refer for delivery and all sorts of things like that, even with a lot of monetary attachments to many of those projects that have been done in the past. But unfortunately, it seems not to have worked because it is a business. So quite a lot of our women in our rural places, over 70% of them still patronizes. So when the child is breached or the child has an abnormal eye or whatever abnormal presentation, so you say someone is trying to give birth for some days in a TBA home, and I've been working in it for 3 years now. And we have reached out to the TBA levels. We train them, we have even invited them. In fact, if you see their organization, the way they are structured, you'll be shocked that the kind of structure that they have is very, very interesting. So we look away from where 70% of the children are giving birth to. We focus, in as much as we encourage them to come to the hospital to give birth and all of that, is it possible for us to begin to think that, can we even integrate this level of care in our healthcare system, whatever we call it, maybe a particular type of certification. I don't know whatever it can be. So I'm just saying that these are one of the big issues that we have and all of that. And of course, issues of universal access, no access, issues of coverage and all of that. And the particular issue that, of course, that bewilders all of us today is the issue of brain drain. I'm not even talking of the people that are traveling abroad that have finished their medical school and they say, oh, okay, I want to jackpot, I want to leave the country and all of that. I'm even talking of internal brain drain. Quite a lot of doctors, because of the experience that they have in the medical school training, I've decided not to practice medicine. They've gone to do some other things. Some other things that they know they have capacity, to do because of some kind of experience that they have. That is why I mentioned earlier that I would like to tailor my presentation towards leading the public health sector with a sense of dignity and self-respect. So the truth is that we have our teachers and the culture and the tradition within the medical training system is a very disciplined system and all of that. But what happens to some of the guys within the system that have not woken up to see that we're in the 21st century and that it is an age of knowledge, it's an age of reason, and that every hand should be on deck for us to be able to raise a new generation of doctors that will be very sound academically, and also we have a lot of emotional connection with their patients. I had a chat with a medical student recently, and she was talking to me about she will never do medicine, even though she likes internal medicine, but she can never do internal medicine because the senior registrar in the internal medicine is a very, very wicked guy. In fact, if they post you in that particular unit, you like cry. She was even telling me that one or two other people have almost entered depression because of that senior registrar. So I was like, please, can you give me the detail of this senior registrar that is doing all of this? If he has personal issues, he should not discourage people, from furthering their career. Because I've also met with quite a lot of people that are in country, they're not practicing medicine because of one or two things that happened during their medical school days. So if we are spending quite a lot of money, if we are spending quite a lot of money to train doctors within our walls, apart from the fact that we're going abroad to look for greener pastures, even the people that are decided to stay, how much are we encouraging them? So when you're asking me to talk about the role of medical students in the Nigeria, in public health sector in Nigeria, I was just wondering, what can I say to you than build your leadership capacity with a sense and revive your sense of dignity and self-respect. Don't grow up and don't become a doctor and think that is the end of it all. This profession is a calling, and that you must treat your patients very, 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 very well with a lot of respect. In 21st century, when we're talking about patient-centered care, medical students, you are there, you are training. I don't know how passionate you are about your patient. I know that many of us, because of the stress of reading and clinical rotations and all of that, I know that we have some level of apathy, that we had because of some kind of teachers that are not friendly, and that they think that by stressing you, will get you frustrated or will get you knowledge of whatever course that you are studying. So I'm challenging the medical students today that make patient the center of your care. The quality of care is no more determined by the outcome of care. What I mean by that is, I came to the hospital, I have diabetic foot, I've now been treated, I've now been managed, I've now been discharged home, and then I'm fine, and so I'm fine. So that is supposed to be the outcome of care. But in the 21st century, we're talking about patient-centeredness. We're talking about the moments of encounter that the patient has within the healthcare system, within the healthcare value chain. You know, what kind of an experience does the patient have? What kind of compassion did the patient feel? You know, what kind of encounter does the patient have with all the tiers of the healthcare system, all departments? You know, so that's how we measure outcome of care, you know, these days, much more than measuring it with that, okay, the patient spent 1 month in the hospital, he was discharged home and he was fine. Can he, if he has to tick your book to say, this is how much I fared in the hospital, and this is the quality of care that I received, you know, are we going to pass for that? So patient-centered care is very key, which I think medical students should put in their, as a focus. And of course, another focus I would like to talk about is medical students should pay attention to the clinical processes. The clinical processes within the hospital. Don't behave as if it doesn't concern you. Don't behave as if I'm just a medical student, I'm just here to just do my rotations. No, you have to provide leadership for others, including your patients. So when I talked about self-leadership, you will have led yourself significantly to identify your strengths and to be able to map out your capacity to be able to influence others positively, and then you can lead others. Then you can be a leader of a team. I remember when I was doing my house we influence our patients. So at this level, you have the opportunity to pay close attention to clinical processes, to clinical governance, you know, within the system. I remembered, I will round up by talking about patient safety. So many medical students have been responsible for saving the life of a lot of patients, you know, because the medical student is passionate, the medical student, you know, is influential, and the medical student has leadership ability to know that I'm not just going through this training to learn the technical part of medicine, I'm also going through this training to be an influential doctor that listens to my patient and put my patient as my priority. Far from the Hippocratic oath that you're waiting to profess in the future. So I would advise you as a senior colleague that if you're looking at your position as a medical student, how you can help reposition Nigerian health system, please study the structure and the institutional framework within the Nigerian health system. Look at the gaps are and begin to speak to it as you have done right now. I will stop there for now. Thank you.
All right, thank you. Thank you very much, sir. That was indeed an enlightening one for we medical students. So I don't know if there's anyone with a question for Dr. Jimlas. You can raise your hand while I allow you on it. Now we'll be taking question for the session we just concluded. All right. If your network isn't too good, you can simply type in your questions in the chat box while Dr. Jimlas takes questions. He has spoken. Dr. Jimlas has spoken extensively on our roles as medical students in public health. He was very passionate about student leadership. If you have any question for Dr. Jimlas regarding leadership, regarding public health, you can type in your questions or raise your hand so I allow you to say. right, Dr. Sandra Jibola will be coming up shortly. We are still waiting for your questions. So thank you all. That was indeed a beautiful presentation by Dr. Jimlas. So up next, we'll be having Dr. Sandra Ajibola. Okay, there's a question in the chat box. Sorry. Okay, before the next speaker, there's a question. Please, has anything been done towards certifying these traditional belt attendants? That's a question. I believe that's a question for Dr. Jimlas. Okay. I think there's another one too. I noticed that the PhD don't usually have doctors in the facility. Why is that? So I think that's all we'll be taking for now because of our time. So Dr. Jimlas, can you please answer these two questions while we proceed to the next session?
With partners help reaching out to the TBAs by training them on how to recognize obstetrics emergencies and all of that. And of course, it will interest you to know that doctors are part of the problem. Professor Dayo is here. In some climb, it will interest you to know that people have been empowered to do what the doctor can do in some other climb, because the doctor does not want to go to the village. The doctor doesn't want to go to the extreme of the extreme, to the rural of the rural. But there is someone that wants to go there. Medicine is apprenticeship. Some places, some other cadre of healthcare workers have been licensed to do some things like cesarean section that is only meant for gynecologists. So doctors will fight. I'm sure that Prof will agree with me. Doctors will fight and say, no, nobody can do CS. It has to be a gynecologist. It has to be but in other clients, when people look at their narrative and they want to make progress, and they really don't want to make their children to continue to die, and they want to make some progress in their health sector indices, of course, they will empower some other category of healthcare worker, give them the skill and under supervision, and get them to start doing things until they are able to do it. The one that government does not want to do, it will interest you to know that it's happening in the private sector. People have been, a lot of my friends that served in Benin, told me that all the surgery that he knows how to do today, it was taught by a nurse in a mission hospital in Edo State when he went for his NYSC. Because the nurse has been there for so many years. She even witnessed the British people setting up the hospital, and she does all sorts of procedures and all of that. She's so good and all of that. But doctors here will say, no, it has to be within this. So we have to keep re-engineering and re-innovating of how we deliver care, especially with the complexity of our system and with the specific narrative that we have. How many doctors do we even have in Nigeria today to attend to a patient? Today we have like about a doctor to God knows how many thousands of patients. So while you're asking a question that as health workers as the TBAs been trained, that is too far. So can a nurse give an IV fluid in the hospital? I don't know whether nurses give IV fluid now, but during that time when I was doing the things, only house officers that give IV fluid. They will even come and say, come and give your IV injection and all of that. They will not, they say, because it is not our work. Our work is to do this, our work is to do that. How are we even maximizing the human resources for health that we have in terms of upscaling knowledge and training and technical training for people to be able to do as much as they can within the healthcare system without just by one or two certification or knowledge enhancement, much more than some kind of professional juggernauts like doctors holding on to everything, holding on to everything. So not willing to go to the rural of the rural. We will empower people that are there. We will teach them. We will train them. We will put them under supervision until they are good enough to be able to do it, so that we can keep saving our people.
Thank you very much.
Hello.
Dr. Jimlas.
Hello, please, can I make a comment, please?
All right, so up next, we'll be having our next speaker. So I'm excited to announce to you all that we have the Director General, Nigerian Center for Disease Control here with us this evening. So we'll be taking Professor Ifedayo Adetifa. Hello, sir. Please, if you're on the call, can you please unmute yourself and speak? All right. I think.
Hello. I'm afraid
Ifedayo
Mr. Adetifa is not on the line.
Dr. Sander.
Sorry, can I just make a little comment on
All right,
what Dr. Jimlas just discussed? Thank you, Dr. Payemi. You made a very beautiful presentation and analysis. I am Dr. Godwin Tadum. I'm the Chief Consultant Epidemiologist of Nigeria. And I here representing the Director of Public Health, who is unavoidably absent. Sorry for my voice. I just had cold and it stole away my voice. Talking about empowering the low medical cadre like the TBAs, you will agree with me that for years now, the use of TBAs have been de-emphasized. If you follow a study that was conducted by Professor Ekele when he was in Sokoto State, he tried to evaluate the people that we call the traditional birth attendants. Yes, I was in the system when UNICEF was empowering the TBAs. A lot of money, WHO, a lot of money was sunk into training them. But after all this training, has there been a reduction in mortality to the pregnant women and others? The answer is no. Our Professor Ekele went on to do a study on the traditional birth attendants. Who are the traditional birth attendants? If you go around, they are very elderly people. Some of them 65, 70, and several of them cannot even see. They cannot read, most of them, because they say they inherited it from their parents, from their mother, from their this. That is how they became birth attendants. And the worst of it all is that they are not trainable. When you cannot impact knowledge.
All right, thank you. I think we lost the chief epidemiologist. So we'll move to the next speaker,
Oh,
Doctor.
Okay, sorry, I mistakenly muted myself. I'm sorry.
Oh, sorry, sir.
Yeah. Okay, what I just want to say here is that by policy, the TBAs don't have any role to play any longer in primary health care in the country. Thank you.
All right. Oh, all right. It appears we had network issues again with the chief consultant epidemiologist. So we're moving on very quickly now. We are sorry we've had a couple of issues before now with the next speaker. We are trying to reconcile attendance and arrangements with the DG of the NCDC, person of Dr. Ifedayo Adetifa, whom we have been informed now that is now on the call. So we'll be having his citation right about now, after which he would will take his presentation. I don't know if if our chief consultant epidemiologist is back. Please, you might want to. Would have you after after the DG's presentation, due to the network issues. Thank you very much. We'll have the citation now.
Okay, I'll take the citation for Dr. Ifedayo Adetifa. Ifedayo Adetifa is a pediatrician and infectious disease epidemiologist, currently an associate professor of infectious disease epidemiology at the London School of Hygiene and Tropical United Kingdom and clinical epidemiologist at the Kenya Medical Research Institute. Welcome Trust Research Program in Ekiti, Kenya. Is the incoming Director General, Nigeria Center for Disease Control. His work in infectious disease epidemiology with a concentration of vaccine preventive diseases as an overarching aim of generating evidence for vaccine policy in low and middle income countries, particularly those of Africa. His current work is focused in two areas: vaccine seroepidemiology research, including to estimating vaccination coverage, population immunity, and force of infection in African settings, and on the scientific basis for the managing pneumococcal conjugate vaccine programs in Africa with only pneumococcal carriage data. His approach has been to conduct disease and serological surveillance, vaccine impact studies, examine approaches to monitoring vaccination, and then complement these with mathematical modeling and health economic evaluations. He also retains an interest in general clinical pediatrics and in pediatric infectious diseases. He has in the recent past worked on tuberculosis epidemiology in the areas of disease burden, case finding, diagnosis, and interventions. Welcome, Dr. Ifedayo Adetifa.
Thank you very much, Ms. Rachel. So, Dr. Ifedayo Adetifa, you can unmute yourself and have the floor, sir. Okay. Dr. Ifedayo Adetifa is here with us. So I will take the citation again. for those of us that couldn't hear properly.
Okay, I will taking the citation of Dr. Ifedayo Adetifa again. Dr. Ifedayo Adetifa is a pediatrician and infectious disease epidemiologist who is currently an associate professor of infectious diseases epidemiology at the London School of Hygiene and Tropical Medicine, United Kingdom, and clinical epidemiologist at the Kenya Medical Research Institute Wellcome Trust Research Program in Cliffy, Kenya. Is the current Director General, Nigerian Center for Disease Control. His work in infectious disease epidemiology with a concentration on vaccine preventable diseases has an overarching aim of generating evidence for vaccine policy in low and middle income countries, particularly those of Africa. His current work is focused in two areas: vaccine seroepidemiology research, including its application to estimating vaccination coverage, population immunity, and force of infection in African settings, and on the scientific basis for the managing pneumococcal conjugate vaccine programs in Africa with only pneumococcal carriage data. His approach has been to conduct disease and serological surveillance, vaccine impact studies, examine approaches to monitoring vaccination, and then to complement these with mathematical modeling and health economic evaluations. He also retains an interest in general and clinical pediatrics and in pediatric infectious diseases. He has in the recent past worked on tuberculosis epidemiology in the areas of disease burden, case finding, diagnostics, and interventions. Welcome, Dr. Ifedayo Adetifa.
Well, thank you very much. You are too kind. Not sure, my head is probably a bit bigger than it normally is after all that, citation. But thank you very much. It's a pleasure to be here, a privilege to have received the invitation. I understand the work you do, having been myself in medical school, being a member of, I think, what used to be SCOPH, and then became SCOPH, as the case may be, and having to also organize events such as this one. I've been asked to talk a bit about the role of medical students as critical stakeholders. And I know that often, having gone through the same experience that you guys have, you're a medical student and you're neither a doctor, or you are feeling that you also know more than the ordinary person. So you're in a bit of limbo where nobody can give you any responsibility, but you're thinking there's a lot that you can do. And that's that feeling, I'm sure, is amplified several fold when there's actually a problem and you're thinking that it can be of some help. So, I mean, these topics that you've picked are actually quite important, and I'd like to congratulate you for your foresight and initiative in considering that subject. I just have a short talk, if I can find it. Let's see if this works. Okay. All right, so can you see this in slideshow mode? Or is it looking at, like, is it the presenter's mode?
In the slideshow mode.
Slideshow mode, okay, excellent. All right, so very quickly, well, we are all in Nigeria, you know what the story is, but just in case people don't know, we are still the most populous country in Africa by a mile, the 7th largest population in the world. And if there's anything that this pandemic has highlighted is that, and I guess the backdrop of all of the other problems we normally have, is that a healthy population actually is a country's most important asset. And with 200+ million people, That's a lot of human capital that should be harnessed into development, into economic progress, into research and innovation, into development. But we are on a journey towards those ideals. And of course, as we speak about journeys and speak about young people, you guys are the future and the ones that would have to take up that journey to hopefully get us to El Dorado. In 2011, NCDC was established with the mandates to protect your health, protect my health, protect the health of all of our families, friends, members of communities. And the NCDC, by that mandate, is the country's National Public Health Institute, which has a vision essentially to ensure a healthier and safe Nigeria through the prevention and control of diseases of public health importance. I mean, what that means obviously is you need to have a disease, it needs to be of public health importance, and that means that whatever is determined to be of public health importance will change from time to time, but I digress. Now, Nigeria's also, the NCDC serves as Nigeria's international health regulations focal point. Now, what the international health regulations do is they were signed up to by all the countries in the world, and they prescribe sort of the minimum standards that need to be adhered to in assuring the health security of countries within their borders, and of course, the global health security as well. As part of our journey towards health security, and it's important that you understand this, joint external evaluation was carried, measures our state of readiness, gives a ready score. As you can see, we scored 39% in 2017, which even in university is a failing grade. A midterm review was done in 2019, and we had made some improvements to 46%. Again, in university, I think maybe for some courses in 100 level or so, 45% was enough to get through, but probably not in medical school. And as a result of the gaps that were identified during the joint external evaluation, Nigeria came up with an action plan for health security, which was the strategy guiding all of the activities that were necessary to assure our health security. So as part of doing that, also in response to the pandemic, the NCDC established what we call emergency operation centers in almost all the states of the country. The only state where we don't have one is Jigawa, but that is currently being prepared. We have a strategic national stockpile, which means we've got essential goods, commodities that are required for emergency response that are stored and waiting to be deployed should there be a reason for them to be needed. We also have ensured now that all 37 states of the country have molecular biology labs, which means, because many of them are in the teaching hospitals and in the federal medical centers and other tertiary centers, is that medical students like you, as part of your training, you'll hopefully have access to and see what polymerase chain reaction and molecular biology testing for diseases looks like. In addition, we've got digital surveillance in all states of the country. That system is called SOMAS. And I think what I need to highlight here is that everybody's hand is needed. This assuring our health security is not just the job of the NCDC, but the job of everybody, including citizens and including medical students as yourself. So where do you come in? So it's important to know that majority of the NCDC's workforce are actually young people like you, okay, including doctors, including other health workers. And these young people they bring to the system energy, dynamism, quest for innovation, including the adoption of new technologies and the like, all in their bid to contribute as we work around the clock to achieve the mandate of the NCDC. So, yes, the traditional pathways, everybody expects that, okay, I'll finish as a medical doctor, I'll specialize in some clinical, surgical, or other specialty, I'll become a consultant, work in a hospital, maybe become a terror yourself to other medical students. I hope none of you will be that. And that seems to be the most common pathway, or at least that was the sort of pipeline or pathway when I was a medical student. The world has changed substantially, and we know that there are many paths to a successful career in medicine, in public health, in health law, in politics, in entrepreneurship. So I encourage you to be attentive to whatever is you're interested in, even if it's beyond the traditional, and just run with it. The best thing you can do for yourself in your career for the rest of your life is to do what you're passionate about and what you're interested in. You've listened to my citation. I trained as a pediatrician. I'm an epidemiologist. I'm now running a public health institute, which means I'm doing public health. So maybe the question is, why didn't I just do public health from the word go and get it over with or something? But every part of my journey or trajectory has actually contributed to who I am today. And I think it's the message that you need to understand is have a broad overview, be interested in, maintain multiple interests. And the fact that you're committed to one interest or one direction at this point in time doesn't mean that you cannot add other things or even delve into other things in the future, as long as it's something that you're interested in and passionate about. You live in this world, you've seen the changes, you're part of our experience as people who are witnessing a once in a century event like a pandemic, but there've also been other things like, flood disasters, fire disasters, building collapse, all of that. It should drive you in the service of the next generation, or even the medical students in the lower levels, to call for a change or updating of the medical school curriculum. The medical school curriculum should include things like how to manage public health or emergency or disaster responses, and how even medical students or anybody who is educated can contribute to that. In this world where everybody is interested in money or what they can make, it's important that you remember that there is a rule for volunteering. Volunteer to clean your environment, volunteer to get new skills, volunteer to help when it's necessary. Make sure that you have first aid training. It's interesting because everybody thinks, oh, I'm a medical student, I therefore know how to look after stuff. But actually, you probably don't. I mean, broadly, yes, but to have a quick targeted response to emergency situations that need first aid, a medical student may find challenging, because our training prepares us to be ready to work in a hospital setting. So you have other people who are going to do some things complementary, but in a first aid setting, you're probably the only one who is there. So you're not depending on anybody to either position the patient properly or the victim or all of that. You need to know everything that needs to be done. So get first aid training. Be conversant with basic life support. There are many students, even many qualified physicians and otherwise, who do not remember or are not up to date in what is required to conduct basic life support. There's a reason why in other places, there's a requirement that you do this every 2 years to keep your skills up to date, so that, God forbid, should that person drop in the airport or on the highway or something, somebody can intervene and keep people going till they can get to hospital. When you've got free time, consider internships or attachments at places like the National Environmental Management, Emergency Management Agency, even at the NCDC or laboratories or other similar agencies at your state, various state and even local government levels. Take up also any training opportunity you see in crisis or disaster risk management, because they open your mind to possibilities and what else can be done, or even prepare you for contributing to response or to health emergency preparedness as a critical stakeholder in that sector. Well, there are opportunities for growth when you graduate from school. There are opportunities for growth at the NCDC and elsewhere. Nigeria has a conference of applied and field epidemiology. Students can attend. When you graduate and you're thinking about a career in field epidemiology, you can take up training in the Nigerian Field Epidemiology Training Program. There's a lot you can do during your youth service. We have a lot of youth corpers, and we are quite in demand for NYSC posting. But I mean, it's got all these youth corpers sitting down here, but they're not just sitting down and twiddling their thumbs. They are doing stuff, entering data and contributing to the work that we do. And even when people have completed their degrees and are thinking about coming back, we've got post-baccalaureate internship opportunities as well for as long as 6 months as well here. But to close, as they say, you can't sit still or stay in one place. You must continue to push. You must keep pushing, and obviously not just pushing in the same trajectory or displacement, but to keep pushing onwards and upwards towards your career objective, your life goals, and everything else that you aspire to. I think that's the end of my talk. Thank you very much for your time. I hope you found this useful.
All right, sir. Thank you very much, sir. I must commend that succinct presentation. Thank you very much for taking your time. It's a great privilege to be with you on this Zoom call and hear from you, tap from a lot of experience and knowledge, sir. Particularly, I must say I was impressed by the feel of your PowerPoint and everything, sir. It's so good to see that you took your time to work that out, despite your busy schedule. Thank you again, sir, for the wonderful presentation. I was particularly moved by the part of how to come in. You said things about getting first aid training, said things about being conversant with basic life support. You also mentioned internships at the NCDC and similar organizations, both at the national and at the state level. Sir, I am happy to inform you, sir, that at the moment, as an association, we have noticed the large deficit in knowledge gap amongst medical students in the aspect of first aid training and basic life support. And that's why we are at the moment looking at a national first aid and basic life support training program, which will involve us training medical students across the country in different medical schools, as well as non-medical students on these skills. And we believe that they will find it very helpful. And since you have mentioned it, we think that it's very important that we inform you ahead of time. So we are hopeful that you will be support our course by the time we finally write to you officially to notify you of what we are doing, sir.
Sorry, I've missed that. Write to me officially about what?
All right. I said at the moment in NiMSA, as a body, we are working on a national first aid and basic life support training project where we intend to train medical students across the country as well as non-medical students on first aid and basic life support skills. So I was saying that since you mentioned how we can come in, that it's really a very interesting one that we could hear from you, and we would like to also let you know our plans as the year proceeds on this particular concept, sir.
Okay, but that's fine. Again, I just hope that as young people, you don't learn some of the bad habits of the adults that have gone before you to, plan. I don't know. I know that NiMSA is a national body, but your first aid training and the things that you need to do should all be done in the various states where medical schools are are located. You've got the Red Cross, St. John's Ambulance Services, and all of that. Those are your local resource people. So there's no need going gathering people, I don't know, in Abuja or Lagos or something. It's this has, for the most benefits, has to be fully decentralized and held locally where medical students are, using all of the readily available resource people. As I said, the typical guys are the Red Cross and St. John's Ambulance Service and the like, Red Crescent, as the case may be. I'm sure you will do your homework to map out all of the people who have the relevant expertise that can support medical associations of medical students to achieve this objective. If I could just quickly, I'm seeing some questions, and medical students cannot work as interns. I mean, if you say work as in a job, I know that the school calendar is really tight for medical students. Basically, I sort of recall barely having any free time from I don't know level or 400 level. Again, depends on which school you are in and the way the curriculum is arranged. But you can look for attachments when you have the opportunity. Attachments allow you to spend time inside an organization and to understand from inside what they are doing. There's a question about how can we get involved in epidemiology programs as students right now. You all have epidemiologists. Everybody I know and maybe first-hand knowledge of all the medical schools you should look within your departments of community medicine or faculties of public health. They all already have epidemiologists, and you can begin to have conversations with them even before sort of, fourth year or fifth year, when you actually get to go do your community medicine project. What else is, I think those are the questions that I've seen. So, okay, back to you.
All right, so I think there are a few more questions in the chat box, sir. Maybe I read them out from here, sir. The question says, how do international master students get internship at the NCDC, sir? Get involved as interns at NCDC?
So, something, again, I'm going to, maybe not criticize you, but highlight something that I think young people don't do enough of. So you've got all your smartphones and all your devices. Go to the NCDC website. I think from time to time, and I think it's open now. So the calls or the applications for internships are open now. And as a matter of fact, I am seeing there are a few, both for even the normal industrial training CWS program that other people in the university do, and even for, so yes. So check our website. If you do not have enough information, then send an email to the contact that is there. We will certainly respond to you. The department at the NCDC that manages internships, as you will see on the website, is the Department of Prevention Programs and Knowledge Management. Okay. Well, I can lecture material I can send. That's not a problem. Any other question?
Yes, one more in the chat box says, how have you been able to combine residency in pediatrics, or how were you able to combine residency in pediatrics along with your passion for public health? Well, sir, before you take the questions, I would like to inform you, sir, that We have some of our other speakers in the room. We have Dr. Jimlas Ogunsakin, the Special Assistant to the State Government on Public Health. We also have Dr. Sande Ajibola from the House of Representatives, as well as the Chief Consultant Epidemiologist of the Federations. He is also in the call room. And then the Dean, Faculty of Clinical Sciences of Obafemi Awolowo University, Professor O. Ishuwande, also in the room, sir.
Excellent. My pleasure to meet your other distinguished speakers here. I think I ran into one of your speakers just yesterday or something, if I recall correctly. But yeah, a pleasure to meet you all. So there's, yeah, okay, interesting. I don't know, did I combine anything there? Okay, so I graduated from medical school I took all the prizes for public health, community health, and even our community-based experience and service called COBIS in University of Ilorin. So I liked community, public health, community medicine, had an aptitude for it. But I also liked doing ward rounds, or so I thought. So I thought I would just do a clinical residency in clinical discipline, and then maybe later on go get a master's in public health or something, and be able to hopefully navigate the interface between looking after one patient or one tree versus the population or the forests. But the summary of that story is that I suffered from a lack of proper career advice. That's the bottom line, really, because we are taught to think about these things in silos, but they are not. There are no silos. I mean, you will find out on the international stage that there are pediatricians who have PhDs in immunology. So they do lab experiments and they're very good at it, but they still go and see their patients and do ward rounds. So I think our education system or the way we practice needs to evolve slightly. And I'm sure it's evolved considerably since the time I left school. But I think what has happened is that in my career path and in the journey, I was just lucky to be able to put all of my interests together. I still like pediatrics. I chose pediatrics just because, you know, you can see the distance between intervention, you know, and an outcome, and a smiling child was very short and very rewarding, you know, not like adults who, even when you have looked after them and they are recovered, either because they are broke or they have problems or something, we still frown or look what, if a child is well, the child starts to play. So they don't hide it. They are innocent, you know, they just start to play and you know, oh yeah, this child is getting better. And that's, I found really rewarding. So while I found it difficult to choose a specialty, I mean, it was this really small differences that made me settle on pediatrics, because I mean, I sort of liked everything that I did. So as I said, you can find a way. It doesn't matter how you start, whether you do public health first or medicine or surgery or whatever first. Find a way to, all of your interests can be accommodated in your career. You will find an option that allows you to do that. Major challenges NCDC faces, or lots. Lots. You see, the work that the NCDC does, or everything that we do in terms of health emergency preparedness or response, which everybody now looks at as a parallel track, is actually dependent on having a properly functioning healthcare system. Okay, and when I say properly functioning healthcare system, I'm talking about down to the basics. So functioning primary healthcare and universal health access or universal health coverage. I mean, there are two different things I hope you know. Is primary healthcare means, you know, making sure that at a population level, everybody has access to some basic provision for healthcare. Some, you know, whereas universal healthcare talks about more of the financing, because part of the problem that makes healthcare inaccessible, even when it is next to your house, is if you do not have money to pay for pay for your card, pay for your drugs, or pay for your investigation. So for health security to work, you need people to have access to healthcare close to them in a way that is not determined by whether they have money or not. Because it's at that healthcare facility that you get the first signal that there's something wrong. So when there's access is restricted to healthcare because of either distance or funding, it means that a condition can arise in the community and go on, affect many people for months before it finally comes to the notice of somebody, maybe at the local government, and then eventually makes it to the state capital before it's reported to a federal agency in Abuja. And that means you cannot respond to anything quickly. Okay, so that's one challenge. Well, rural communities, just by the fact that they are distant, they are underserved, there's maybe no, there is not enough of even a telephone network to, you have to find one corner or one hill or near one tree to even be able to make a phone call. Means that the whole intelligence about quickly having things reported, having your surveillance data captured digitally and sent on so that people can pick signals of that there are things happening, makes all of that a bit challenging. So these are some of the challenges that we face. Obviously, in the most local, most rural settings, if I take a survey of all of you medical students now, how many of you would like to go take up a job in your village when you graduate? Any show of hands? I mean, unless, of course, your village is Lagos or something, it's Lagos City or Abuja Municipal, who wants to go and take a job in his village? Okay, two people raise their hand. I'm sure these guys are from capital cities. So, so the point I'm trying to make really is that, again, part of the problem in rural areas is staffing. So healthcare workers, such as yourself, don't want to go and work in rural centers. So there's a shortage of the kind of expert staff that you need to look after people, to conduct surveillance, to do all of that. And that is another challenge for us. Every challenge that's a challenge for just normal healthcare delivery, believe it or not, affects the work that the NCDC does, because that's the system that needs to work for all of us. Okay, I see many more people in the chat box are refusing to go and work in their villages. I'm writing down your names.
Thank you very much, sir. That was quite elaborate. Before the end of Dr. Ifedayo's session, I don't know if our other speakers might like to have a word for Dr. Ifedayo, Dr. Jimlas. Do you have a word for Dr. Ifedayo?
Thank you very much, Dr. Adetifa, for gracing the occasion. And thank you for the leadership that you are providing at the NCDC. For your information, Dr. Adetifa is from Ekiti, so he's our proud son. Thank you so much.
Absolutely.
Thank you very much, Dr. Jimlas. I don't know if Dr. Sanda is here. Would you like to have a word for Dr. Adetifa? All right, I think Dr. Sanda is not here. The Dean of Clinical Sciences, Obafemi Awolowo University, Professor Showande, you have a word for Dr. Adetifa. All right.
Hello.
Okay.
Thank you, sir, for that beautiful presentation. And it's obvious it was born out of experience. And that is the kind of guidance that will enable our students to make the right choices for the future from practical experience. I want to thank you for that and for the leadership that you are providing from NDDC. I can see that a lot of our students are actually in a hurry to get to the top very fast. And if they really think about it, the road is very tough, but then you have to make, the right decisions at the right time. And what you have done, your experience, is probably a good example of how to go about it. I quite agree with you that you can't be a surgeon and still be a public health specialist or expert. It's just the pathway that you need to be very, sure of. I would just advise our students not to be in a hurry. And like I've said in the beginning, they are the future. They have a very big role to play. And I can see SCOPH and the entire medical students generation going places, with this approach that they have, taken in addressing public health issues in the country. I want to comment on Opeyemi's comment the last time about some senior registrars, becoming demons and all those things. I think those things are changing with enlightenment and, with advance in critical thinking. A lot of these things are changing. You can't, miss out one or two people with that kind of behavior, in medical school. And that should not discourage, our students. There are still some people who still act the way they are, they are difficult to change. So, Dr. Adetifa, thank you for your presentation. I actually learned a lot of things from it, so, and I hope that when I advise medical students, I will be able to refer them to this kind of experience that you have given to us. Thank you very much.
Thank you, sir. Thank you very much. Thank you, everybody.
Yeah, thank you, sir.
Yeah.
That we come to the end of this session. Oh, sorry, we have the chief epidemiologist here. I don't know if I have a word for Dr. Adetifa.
Who is that, Doctor?
Hello, isn't that sir?
Yeah, I didn't see your hand up.
Good evening, sir. Very fine. Very fine. Thank you for the presentation. You have combined the quality of a fantastic teacher with that of an administrator. I am really impressed. Thank you, sir.
Yes, sir. Thank you very much.
I don't know if it's time for me to make the presentation on behalf of the Director of Public Health.
Not yet, sir.
Okay, thank you.
Okay, all right, I'm going to go now. Thank you all very much. And as I said, all the best.
Thank you very much, sir. It's really a wonderful time, sir.
Really appreciate it. Thank you, sir.
All right.
Okay, I think we need to I need to get into another meeting. Thank you so much, Prof. Thank you so much for your.
Okay, thank you very much.
I really appreciate it. To our younger colleagues, please keep it real and don't be in a hurry to happen. Don't be in a hurry to happen. It takes process. If you go up, you jump up, but if you grow up, you stay up. So take your time and grow up. And one of the best things that the medical profession, the medical school has done is that integrity of knowledge and of discipline that we got from there. So it makes us to excel anywhere in life where we find ourselves. Today, I'm in active politics. I never planned to be, but I'm there. And of course, the aroma of being a doctor is always an advantage in every sphere of influence. So let me encourage you to keep on keeping on and follow the process. Thank you. Thank you so much. God bless and bye-bye.
Thank you very much, sir. That was a wise one. Jump up, come down. Prof is still up. Thank you, sir. So I don't know if Dr. Sanda is here. Just would like to take your presentation next. Dr. Sanda Jibara. All right, I think Dr. Sanda is not here. We'll be taking the representative of the director, that's Dr. Alex Okomorenike, the Director of the Department of Public Health, is well represented here by the Chief Epidemiologist of the nation. So very briefly, we'll be taking the presentation in the next 5 minutes. Sir. I'm Mr. Tadum from the Federal Ministry of Health. Would like to have a presentation now on behalf of the director. If you are here with us, can you please unmute yourself and...
Hello, can you hear me now?
Hello, sir, we can hear you, sir.
Thank you so much.
Yes, sir.
For this. Well, I am speaking on behalf of the Director of Public Health, the Federal Ministry of Health. Pardon me for my voice. I had cold about 2 days ago, and the outcome is what you can hear. It seized my voice. Please, I would also like to project my slides.
You're free, sir.
Okay, thank you. Oh, the screen has been disabled, so I cannot connect. Maybe you have to allow me from the other end.
I'll make you a co-host. I'll do that. Okay. All right, sir. Can you try again now?
Okay, thank you. Can you see my slide?
Yes, we can see it, sir.
Okay,
yes,
once
sir.
again, good evening, our profs and my colleagues, and also all the teachers present in this presentation.
Good evening.
I have the privilege to present on behalf of the Director of Public Health, Federal Ministry of Health. Like I said earlier, I am Dr. Godwin Tadum, the Chief Epidemiologist of the country. And Dr. Ifedayo has actually presented almost everything. Because if you think of the ministry, you are thinking of the policy maker and the implementers. The implementers are actually the people who go to the field, who do most of the work. The role of the ministry is to formulate policy and also to design strategies. That notwithstanding, we still play a lot of role because all diseases of public health interest are not the ones that, and they don't all require emergencies. So you still have diseases that may not require going to the field, that may not require urgent actions. You have non-communicable diseases being under public health. These infectious diseases, just like malaria, tuberculosis, and others. Then you as well have the epidemiology division that tries to look at all this, like we say, they determine, they design, they look for the deterrence of the diseases, define the diseases and where they are located, who is affected, and why are they affected. So these are all within the public health department. And again, I don't want us to see differently. We are working as one body. Both the agencies and the ministry are working to achieve similar goal, to ensure that people don't fall ill and don't die as a result of diseases. And most importantly, Nigeria up to now we still suffer from outbreaks. We have Lassa fever, we have diseases like cholera, we have diseases like meningitis still afflicting so many people, and we still record very high mortality as a result of these diseases. It should not be, but unfortunately, we still record, like last year, we recorded almost the highest cases of cholera in 21st century. You find it very difficult to believe, whereas it has become a thing of the past in some other countries. And we know these diseases are not as a result of the weakness of the health facilities of cool, but it goes into the environment, into the communities, and these are where the public health people are expected to act. Like has been defined here, public health is considered to be about, public health has been, I'm trying to minimize. Yes, public health is considered to be about the health of people or communities as opposed to individuals. Each time you think in terms of public health, you don't consider one disease. In fact, one disease is only telling you, like if there's a case of cholera, you've been able to give a definitive diagnosis of a cholera. You don't focus on that individual again. That individual is moved to the hospital, but that's when the work of the public health physician begins, because your role is to protect the safety and improving the health of the communities. You are looking at the people. What can you do, or what are you going to do within that period to ensure that that disease does not spread? If it has spread, how do you get them to be treated into the facility? If they've been affected and they are in the hospital, how do you reduce disability? And you also plan to rehabilitate the sick people. So it's a whole lot of work for the public health. Oftentimes we'll try to look at clinical medicine and the role the public health play. Clinical medicine will give you knowledge about one individual that has fallen sick. You want to carry out investigation, do this. But public health, in the other hand, will go oftentimes to the community. Sometimes it may be like the issue of when we begin to talk of COVID, we are not talking about individuals any longer. It's a global problem. So we begin to look at it. Countries have to begin to take measures. The port health begin to work. So many things, surveillance are in place. That's where agencies like SCDC comes in to take. SCDC is acting like the soldiers of diseases in the country to ensure that this disease does not spread. Whereas the public health and other departments provide backup to see, yes, this is what we should do. Plan strategically, formulate policies that will help the country. Like if you see now from time to time, they keep on changing port health policies. For you to come into Nigeria, you have to do this. For you to go out of Nigeria, you have to do this. You have to do that. That is the responsibility of public health. At the end of it, you sit down, you look at all the deployed strategy. How has it affected the disease? How are people faring? Then you evaluate. You use that to really replan again. So these are some of the roles the public health department plays. Like I said, so many other diseases that don't require this outbreak investigation and co, because they are endemic. Some of them are endemic. Some of them we have been able to study their pattern. So you look at ways of ensuring that those diseases are completely controlled. We thought our DG spoke about surveillance, analysis and evaluation of population health status. It's very important when you are as a public health a physician or personnel. You, like I said, you don't look at, if I'm thinking of Kano, I will be thinking of Kano in terms of their total health status. What are the determinants of health in Kano? What are the deterrents and the distribution of those diseases in that setup? Then the ministry begin to plan. Coming to individual, the role of medical students in public health. Well, like DG has also said, you cannot go out now and begin to work as doctors. That does not take place. It's not a kind of profession like you say you are learning mechanical engineering and you go to stay with the mechanic during vacation to do some work. In medical practice, it is not allowed. Then where do we actually come into play when it comes to this? We have a role. In the past, I've seen students, medical students from universities coming to public health department asking for nets to distribute during when they're in places where there are mosquitoes and you have a high prevalence of malaria. They come to ask for net. Some of them have come to ask for other things that are not really medicine and other things. And again, they've engaged themselves in several public awareness campaigns. I must tell you also, so many years, about 30 years ago, when I was in UI Medical School also, then NiMSA was very active then. I still remember then the headquarters was actually in UCH then. And so many, they mobilize students. They all go out to areas in Ibadan like Bere, Foko, those slum areas. And they do, apart from talking to the people, they support in clearing all those gutters. And when you see them say, who are these? They say medical students from University of Ibadan, medical students. So some of these, they actually play significant role. Because if you clear your environment, you advocate to the community the reason they should have well, the reason they should have toilets, it goes a long way in preventing diseases. That's all what public health is all about. It's not about giving medicine. In fact, the last thing you think of when you are talking public health is medicine. Because once you are thinking of medicine, apart from the preventive medicine, you have come to a stage where you have to hand over to the people in the clinics. But your work begins before that they need medicine. That's provision of wealth, provision of training them on sanitation. Many of them can't even associate mosquito bites to malaria. If you begin to ask people, they tell you, oh, it's caused by sun, it's caused by this. but medical students can go out and really educate, send questionnaire to communities and see their knowledge about, seek their knowledge about some of these conditions. If you realize that they are really poor in knowledge, because we may be in an environment where there's a major disease, but yet those people are living with the cause of those diseases. And it is now your responsibility to go to this community. I must tell you that the Federal Ministry of Health, through the Department of Public Health, receives application requests from schools on if you need some materials, materials, sensitization materials, advocacy materials, they are there. It is for you to apply. Sometimes if you need some preventive treatment, so many schools have applied and they've been given. So it is important we know we have all this information that you may get something to assist you. Unfortunately, they may not be able to give you money, but when it comes to materials, they have a lot to support you. Now, medical students serve as representative of student community to engage decision makers and bring up policies to identify public health problems. There may be successful individuals, companies within a neighborhood who are there, they don't know what to do to support their communities. Association can go to them, NiMSA can go to them, talk to them. This is the challenge in this environment. They all want their name to be in news. Don't mind them even if they choose to bring out the press in the state. It doesn't matter to you. But the important thing is that you are getting what you want from them. They may even pledge that, oh, this community, what we have, their need is water, borehole. Let them build the borehole and put their names there. It doesn't matter. But the rest, so somebody needs to tell them as what they need to do. Now, I've talked extensively on health promotion. We can go around, let them know that what causes cholera is, polluted environment, not using the toilet. What causes malaria is mosquitoes. What causes this? We can educate them. We can also use pamphlets. Like I said, the Federal Ministry of Health, Department of Health Promotion, they have this in abundance. So it is also for us to apply for them. And they are definitely going to send it down to you. Even at the stable, they have some of these materials. Now, to develop effective program and health facilities to protect health development, like has been said, population, even population control. Now we are talking about Nigerian population. Sometimes it's easier for younger generation to talk on some of these issues, not as doctor to patient, but as friends. You understand? Then also we can work on some of the findings of studies and use it as some of as change agents. We talk to our colleagues, we talk to our parents, it goes a long way. And also, like I say, you can conduct community outreach. And surprisingly, when you go out as a team, medical students, talking to communities, even in the marketplaces, you are admirable, people wait to listen to you. They are wondering why you have to come that far to talk to them. And it goes a long way to think what radio has been shouting, television has been shouting, and it's not sinking. For you to just stay with them to talk for some minutes, we do a lot of magic. When also talking about the role, in some areas, you have to do some research also. As medical students begin to do some basic research work, finding problems in your locality. What are the major problems? What are the contributing factors? You look at it in a whole and in parts, and you can make some simple publications. That's one thing I always encourage. Like one of my senior colleagues in those days, we say publish anything. Even if it's not, your sample size is not much, make it an anecdotal report. It's not going to Facebook and sharing so many things that are unnecessary. If you share your finding, it goes a long way to educate people. These are some things you can do as medical student. You can also have a website where you divulge important information on health, basic information. And this will be a good way of reaching out to community. Like I've always been saying, each time you are talking about public health, your talk all the time is community. The DG also said, and our first speaker, he said, if you go because you want to make profit, financial gain, it may never come. We are suddenly becoming like the teachers, where our reward will be in heaven. But when we pray that things will change to better, like he has talked about the way at which people move out of the country. When I graduated in medical school in 1992, we were about 125. Now there are just about 20 of us in the country. Can you imagine that? Only 20. So things are changing. But if you really want to assist this country, you have to be patriotic. You have to be around and see what you can do. And we keep on praying that one day things will change for the better. We have major challenges, several of them the DG mentioned. Migration, like I said, exodus from peripheral community. He has spoken about that extensively. Probably many of you saw the video that circulated, the WhatsApp message where they came to recruit doctors from Saudi Arabia in Lagos and in Abuja. And honestly, I was in Abuja then, and more than 500 doctors. These are not just doctors, they are senior doctors. There's several of them consultants who should, play very significant role in this country. But when you ask them, say, look, I cannot be patriotic. I'm not able to pay my children's school fee. They have reasons. That's why we are going to pray that God change this country for the better. Brain drain is real in this country. And again, talking about quackery, I tried to talk a bit about it the other time. When you empower the non-skilled officers, they don't know where to stop. The TPAs is got to a point that they were not referring until the patient is about to die. And at that point, nothing can be done to salvage such individuals. That was one of the reasons why UNICEF stopped the funding of TBAs, WHO follows suit, and the federal government does not mention them again. So we still need to play. Yes, you can give some roles, but it's too far away to say a non-medically oriented trained person will go and perform cesarean section. I will not allow my wife to go to such a person. What about, have you thought of the complication for the mother, complication for the child? This takes a whole lot of time to learn. So even when we are shifting, doing task shifting, we should know where to stop. That is what I have. We are needed in this country. And as patriotic citizens, let's continue to pray and work very hard. I believe by the time many of you leave medical schools, things would have gotten better. That is my prayer. Therefore, medical students have critical role. You have to organize programs for better funding for the institution where you are. I must tell you, the universities is the way. When I was in UI, I stayed in one room on my own in ABH. The last time I visited, there are now 4 people in the same room I stayed. 4 as a final year medical student. So you can see some of these challenges. So when we see all these people making noise and say, oh, the university system is going back, it is real, but we continue to pray that things will get better over time. And also, we must learn to be volunteers. By the time you enter public health, I've gone to communities where I have to be carried on Okada for several kilometers because there was no motorable road. Those are some of these services. I got to a community in Bauchi State, Toro local government area. The man I met said, you are the first Baban Likita. Baban Likita in Hausa is real doctor that he's seen in his life. He has never seen a Baban Likita. All the people that come around are CHOs. They are what they call CHIO, community health extension workers. So in these communities, they are lacking in a lot of things. And the community health extension worker is so limited in what they learn. So if they don't have personnel, how then do you prevent the high mortality that are coming from all the villages in the country? Yes, we have to be patriotic and ready to serve this country. Thank you very much for listening.
Thank you very much, sir. That was indeed elaborate. So right now, time is fast spent already. We'll be taking just one or two questions from the audience if there are any questions for the speaker. So during your session, you mentioned that there are a lot of equipment. If students can just make requests, we can always
not equipment, promotional materials.
Oh, sorry, promotional materials. If students can make
and some medicines also.
Yeah, that it can be made available to us. So I would like to ask, how can we make requests for these things, sir?
You still direct the letter to the Director of Public Health, Federal Ministry of Health. She will minute it appropriately to the right department, to the right division.
All right, thank you, sir. So Nigerian medical students, if we need any promotional materials for our public health engagements, like Chief Epidemiologist said, we can write our letters, direct our letters to the Director Department of Public Health and to be directed to the appropriate quarters. I don't know if we have any question now. Okay, I think there's a question here. Concerning questionnaires, is there a way we can modify questionnaire for, say, group markets, men with a large number of people who can't read? All right, I think.
Well, it depends on your target population. And it depends on what you want to do. The information you want is what is going to direct the questionnaire. So if you have a target population, you just follow them. It does not have to be in a market. It could be a community. It could be a community challenge that you want to find out. So you can always direct your questionnaire to such population.
All right, thank you very much, sir. Also, such question will be answered more tomorrow because tomorrow we are considering proper tomorrow. So I would like the person that asked that question to be around tomorrow, and that question will be treated extensively tomorrow. So I think with that, we come to the end of session. We'll be inviting Director now, NiMSA SCOPH, Mr. Ifedayo Femi Matthew.
All right. Thank you very much. We are very grateful. Thank you all for. It was nice listening to our different speakers. I'm sure we have learned quite a lot today. For me, I think that with this useful pieces of information, medical students, members of the Nigerian Medical Students Association, can now go out to our different communities and lead very important and significant public health initiatives with the support of the government and other stakeholders, as has been promised. Thank you very much. This is day one of our event. By tomorrow, we'll be doing a lot more research. And by tomorrow, we'll also be learning from fellow medical students who are leading NGOs and who are doing a few things within the public health space. And then hopefully we can pick a few things about how to balance our academics with all of these things. A very big and wonderful thank you to all our speakers, for some of them who are out now. Our chief consultant epidemiologist, thank you very much, sir. Dr. Ifedayo, Adetifa, thank you very much, sir. Even in absentia, Dr. Jimlas, thank you very much as well. And we were supposed to have a fourth speaker in person of Dr. Sandhya, who unfortunately could not wait any longer. Thank you very much also. We also want to appreciate the leadership of the Nigerian Medical Students Association, as well as other national executives of the association, CACLOS chairman, MSC presidents, and across the country. Thank you very much for tuning in today. We hope to see you again by tomorrow. We will communicate the link to us on the respective group pages. Thank you very much. We'll see you by 12 p.m. tomorrow.
Thank you very much. So with that, we come to the end of the summit for day one. I hope to see you all tomorrow. Thank you. You can take our leave now and exit the Zoom call now.